Hi, good morning. I'm gonna perform an auto scenario. So I just got called from the station that the physician would like the patient to be hooked up with a nasal cannula. So before I did go inside the patient's room, always check the chart to ensure that the physician really ordered it. And then I also have to double check everything, such as any information. And then once inside, I always introduce myself and then explain to the patient what I'm trying to do by telling them that the physician would like to hook them up with an oxygen just to relieve them from difficulty in breathing, and also it would improve their oxygenation. And then I will always do my pre-assessment, obtain vital signs, and then I also have to check the ID band to ensure the patient is the correct patient for confirmatory purposes. And then after that, I always hook this one to the patient, ensure there are no kinks, and then turn it up with the desired flow that the doctor would like to hook up at 3 liters. So before hooking up to the patient, make sure the connections are being loosened, and then feel it with your fingers if there's air coming out and it's no longer kink. Then carefully insert to the patient's nose, and then with the hook up in their earlobes. And then once done, we always have to reassess the patient and then double check everything by their vital signs, and then we can leave the patient for them to rest. Then in a few while later today, I just got called that the physician would like to reassess the patient, especially they noticed something wrong with the patient. So when I was inside, I noticed the patient to be mouth breathing. So they definitely, we knew that the patient was not able to tolerate the nasal cannula, and then there's something underlying problem with them. So we also noticed the patient's ABG to be decreased with their CO2 high, more than their normal values, and then their oxygen levels had dropped. So I immediately attach it with a Venturi mask. So in that way, the patient would receive a precise FiO2 regardless of the flow. It could have been better if we can use it with a simple mask, but with a simple mask, the patient might lead to rebreathe carbon dioxide, which might be worse for the patient. So because the flow of 3 liters, so the physician or the patient 3 times 4, so we can set it up with about 31% FiO2 with a Venturi mask, and then make sure we fill it with our hands, that there's air coming out, and then we try to loosen this one a bit. And then regardless if of the patient's condition, be it conscious or lethargic, we still explain it to the patient that we're gonna change it with a new device for them to receive more oxygen. Make sure we reposition it, that this one is not kink, no obstructions or any blankets be covering it. And then with the nasal cannula, we can just put it on a clean plastic container with or plastic bag, and then set it aside so that later on or in the long run, maybe they want to be using this if the patient's being stabilized. So every time it's done, make sure we reassess again the patient, obtain vital signs, re-auscultate, and then once outside, we always have to chart everything that we change with a new device, and then communicate with the physician who ordered it within the nurse in charge, so that they know that we already changed with a new device.